Welcome to Drive-Through Therapy. Today's video is on the effects of tolerance on alcohol and opiates. I'm going to first start off with opiates first. Most people who start using opiates usually begin with what I call the rookie phase of using. They usually start off with occasional use of perk 30s or oxycodones, maybe one or two a day. Then before you know it, they soon increase the amount and frequency to get the same high as when they first started using. As this occurs unaware to them, the rookie phase is quickly ending. While this is occurring, their tolerance is secretly rising, meaning they will need more just to get the same effect as they did when they first started. As they continue to use, up goes the doses and their need to maintain their addiction. Usually at this point, in many cases, there is a switch to heroin because it is cheaper and much readily available. Soon there occurs a switch to IV drug use, completing the vicious cycle. Keep in mind, when all these phases are occurring, the tolerance factor is in play, meaning 4 bags a day, then 5, then 6, and on and on and on. Just recently, the heroin has become much more potent because of dealers cutting the heroin with fentanyl. Fentanyl, by the way, is approximately 100 times more potent than morphine, thus causing high rates of overdoses, unfortunately. Here is another important fact as it relates to the tolerance factor. If a person is using, let's say, 8 bags of heroin per day, and they stop using for 5 years or longer, then they relapse. They will have a baseline of 8 bags. Within a day or two of their reusing, meaning they go back to the beginning cycle of using. They continue to use, that means sooner or later it will be 9, 10 bags, so forth and so on, a day habit. Another tidbit here is if they stop using for a long period, say 5 years or longer, if they need to go to an emergency room for treatment for something that is causing pain, such as kidney stones or an injury, they will need to inform the staff that they have had a history of opiate dependence in order for the medical staff to treat the condition accordingly. Alcohol tolerance is similar to opiates, but does differ due to the time factor. It takes years versus months to take hold. With alcohol, it generally depends on the amount and frequency that influences a rise in the tolerance. Simply put, the more drinks needed to reach their buzz point will determine where a person is on the tolerance scale. Again, as it is with opiates, if a person stops drinking for, let's say, 5 years or longer, and then there's a relapse, they go back to their drinking pattern and return to their baseline, meaning they return right back to the amount that they drank the day they had stopped. Let's say a person stopped for 8 years and they were drinking 10 to 12 beers per day for the buzz and the effect, and they decide to return to drinking. They may not drink 10 beers or so on the first day, but will quickly return to drinking the 10 plus within a day or two. They do not return to their past when they started drinking 3 or 4 as they did when, say, they were in their 20s. They get right back on their tolerance train just like there was no break. As I finish here with alcohol, there is one more tolerance issue to discuss, and that is reverse tolerance. It becomes an issue usually later in one's drinking career. It is when a person gets intoxicated with less consumption. Example would be if one has needed, say, 6 glasses of wine to get a good buzz, then it drops down to 5, then 4, and then down to 3 to get the same buzz that the 6 would. This becomes very dangerous because it sneaks up on people without them even realizing that this is happening. This can be seen in the elderly population with an increase of falls and injuries. The medical reasoning is that with age, the liver and the brain doesn't process the alcohol as efficiently as it once did. Another tidbit is how tolerance does affect other substances, not just alcohol and opiates, but say smoking. If somebody is smoking a pack and a half a day and they decide to quit for 5 years, and they decide to relapse after 5 years, the first day they probably will not smoke a pack and a half, but guaranteed by day 2 or 3 they are smoking a pack and a half. Along with that, there's I'm just going to throw this tidbit in because this is ironic, is that let's say grandma has a $50 scratch ticket habit a day, and she gets pressure from the family to quit, so she stops buying scratch tickets for a year. And one day grandma goes to the store and she sees scratch tickets on the ground. She gets the urge to buy some, so she goes in and buys a couple. And she scratches them off, and once a winner she goes back in and she buys a few more. Guaranteed by the next day or the second day, grandma will be definitely buying $50 scratch tickets a day. I hope this video has been some helpful and some insight to you. Stay tuned for my other videos.